The Northern Illinois Center for Nonprofit Excellence, more fondly known as NICNE, has been strengthening nonprofits by providing training, leadership development, technical assistance, and resource supports for nonprofit organizations within Northern Illinois and Southern Wisconsin since August of 2004. At NICNE, we believe in investing in people and organizations that make communities in our area safer, healthier, and more vibrant. In September 2023, NICNE was awarded funding from the Winnebago County Community Mental Health Board, supported by the half-cent sales tax. This funding has allowed NICNE and collaborating partners to significantly expand the Rockford Area Case Management Initiative and enhance support for case managers and clinicians within local mental health and substance abuse organizations. The case management training uses a community-wide approach to case management that is strength-based, outcome-focused, and person and equity-centered. This approach focuses on supporting participants' achievement of specific self-defined outcomes leading to their self-sufficiency. The Mental Health Board funding has given us the opportunity to scale up the initiative by engaging mental health and substance abuse case managers and supervisors in group and module training, and growing the community of practice to increase knowledge of available services within the community support system framework. This work complements the implementation of IRIS, the integrated referral and intake system, cultivating relationships, expediting access to services, and enhancing referrals. We are tremendously grateful for this grant that has also allowed us to hire a full-time staff person dedicated to the case management initiative and work with Boston University and a PhD student at NIU to develop an evaluation tool. After our first year of funding, we already see a more coordinated and effective service delivery system, benefiting both service providers and the participants they serve. Thank you, Winnebago County Mental Health Board. Your funding is changing lives and improving results in our community.
The Winnebago County Community Mental Health Board is a vital partner and resource for the RACMI. Since receiving funding in September of 2023, we have offered 7 additional free community of practice sessions and have served 575 individuals. I became involved with the RACMI in 2016 through the initial planning group, which was a collaboration between several area human services organizations working to improve case management outcomes for people in our community. The initial planning group met for nearly 2 years to build a community-wide approach to case management, which included establishing a common agenda, shared language, training curriculum, and a community of practice to professionalize the field of case management. Since 2016, the RACMI has trained and supported thousands of case managers and frontline staff from across our community. Community of practice sessions provide valuable and relevant information for all case managers and human services professionals, regardless of their areas of service. These events strengthen skills and increase knowledge on specialized topics, share information and best practices for case management in general, and provide an opportunity for networking among local case managers to help them successfully implement the foundational skills of the community-wide approach to case management.
Hi, my name is Courtney Geiger, and I'm the Director of Mission Services at Goodwill Industries of Northern Illinois, and I've been a part of the Rockford Area Case Management Initiative, or RACMI, since its inception. In addition to community of practice sessions, NICNE offers case management trainings to local community case managers. Back in June of 2017, nationally recognized case management expert Dr. Beverly Ford conducted the first RACMI large group training. Nearly 120 case managers from over 40 agencies participated in the full 2 days of training. Several local case managers and supervisors also attended an additional day of training to form a team of local trainers. This training impacted the way Goodwill does case management for our participants, and it impacted the way case management is done for several other organizations. Part of RACMI is to continue to provide these sessions 2 times per year free of charge for community case managers. Empowering people for change, making case management work, focuses on foundational principles of person-centered, outcome-based case management and a journey to self-sufficiency. The training changes the way case management is delivered by actively engaging participants in setting and achieving their own goals. The approach focuses on strengths and moves away from doing for individuals what they can do for themselves. Participants become the lead partner, and case managers are a backup and a resource. Participants become responsible for change because ultimately, they are the ones that decide to make changes happen.
Hi, my name is Dr. Dory Hutchinson, and I'm the Executive Director of the Center for Psychiatric Rehabilitation at Boston University. And since last fall, I've had the privilege of working on the Rockford Area Case Management Initiative Program Evaluation. I've been working with Deanna Mershon and Danny Hosk on evaluating the impact of the trainings and the community of practice on case managers and on the people served by these case managers. We did a qualitative program of evaluation so we could listen to the voices of the case managers and of the people that they served. And in listening, 3 powerful areas of their practice have been impacted by the training and the community of practice. One is that they feel very skilled in building mutual and trusting and respectful relationships with their clients. And this foundation of trust has allowed them then to focus on people's strengths instead of their diseases and dysfunction and disabilities. And this strategy of being person-centered has also been very impactful in their work, as it allows them to work with someone rather than work on someone. And this has a ripple effect in 2 directions. It supports their clients to grow and change, and the case managers report feeling less burned out. And finally, the theme of empowerment, the value and the principle and the actions that go with empowerment was reported by the case managers being really important to them, and having the skills to actualize this has been transformative. They have seen their clients become more resilient and more hopeful. Their clients are working, they are accessing community resources, and they are living independent and self-determined lives. Their clients then told us that their lives and the lives of their families have been positively transformed and changed because of the empowering and trusting relationships that they have with their case managers. They feel more resilient, more capable of facing life's challenges, and more hopeful. So I think we could say that this case management training and community of practice is highly valuable, as it elevates the skills of the case managers, it increases their knowledge of community resources, and it reduces their burnout and increases their empowerment as case managers. This then has such a transformative impact and ripple on the lives of the people they assist to live full lives in their communities.